Part A. Extract 1. Questions 1 to 12. You hear a nurse talking to a patient called Mihira. You now have 30 seconds to look at the notes. Good morning, Mihira. I'm Norris Lehman, one of the nurses here. What brings you in today?
Good morning. I've been having this awful pain in my lower back for a couple of weeks now. It radiates down my right leg, and it gets worse when I sit or bend forward. I've also started to feel some numbness in my toes. I thought it might go away on its own, but it's not improving.
Good morning. I've been having this awful pain in my lower back for a couple of weeks now. It radiates down my right leg, and it gets worse when I sit or bend forward. I've also started to feel some numbness in my toes. I thought it might go away on its own, but it's not improving.
That sounds very uncomfortable. I understand how much this can impact your daily routine. Mihira, have you tried any treatments or medications for it so far?
Yes, I've been taking over-the-counter painkillers like ibuprofen and paracetamol, but they only provide temporary relief. I also tried using heat pads and doing some light stretching exercises, but nothing seemed to make a lasting difference.
Alright, so it sounds like painkillers and home remedies haven't been too effective for you. Have you experienced any similar issues, or is this the first time you've had this kind of problem?
I've had some mild lower back pain before, especially after long days at work, but it's never been this bad. I've also had neck stiffness off and on over the years, but nothing serious. My overall health is pretty good, but this pain is just too much.
Thank you for sharing that. Based on your symptoms, it's possible that you might have a herniated disc. The pain you've described, especially the sharp sensation that travels down your leg, along with the numbness, can be signs of this condition. Essentially, it occurs when the cushion between your vertebrae bulges out, pressing on the nerves in the spine.
Oh, I see. That sounds serious. Is it something that can be treated easily?
Mihira, in many cases, this can be managed effectively with the right treatment. First, though, we'll need to confirm the diagnosis with some tests. I'd recommend starting with an MRI, which will give us a clear image of your spine and show whether a disc is pressing on your nerves. We might also conduct a physical exam to check your range of motion and see if certain movements trigger the pain.
Okay, that sounds reasonable. What kind of treatment would I need if it is a herniated disc?
Depending on the severity, treatment can range from conservative methods like physical therapy and medications to more advanced options. For instance, a physiotherapist can guide you through exercises to strengthen the muscles around your spine and improve your posture, which can relieve pressure on the affected disc. Anti-inflammatory medications like naproxen or stronger pain relievers can help reduce inflammation and manage the pain. In some cases, corticosteroid injections might be necessary to decrease swelling around the nerves.
And how long would that kind of treatment take?
It depends on your progress. However, if conservative treatments don't provide relief after a few months, we might need to explore surgical options. But that's usually the last resort.
That's good to know. I appreciate the information.
You're welcome, Mihira. We'll get you on the path to feeling better soon.
Extract 2. Questions 13 to 24. You hear a doctor talking to a patient called Mihira. You now have 30 seconds to look at the notes.
Good morning, Mihira. How are you feeling today?
Good morning, doctor. To be honest, I'm quite worried. I've been feeling really unwell for about a week now, and my symptoms don't seem to be improving.
I'm sorry to hear that. Could you describe in detail what you've been experiencing? What's been the most difficult for you?
Well, it started with a really high fever, around 39 degrees Celsius. I took some paracetamol at first, thinking it was just the flu, but the fever hasn't gone away. I'm also feeling extremely fatigued, almost like I can't even get out of bed. I've had headaches that come and go, but they're getting more severe. It's making it hard to concentrate on anything, even resting. On top of that, I've had muscle pain all over, especially in my back and legs. A few days after the fever started, I noticed some nausea, and I vomited a couple of times. I'm also dealing with a sore throat, and I've developed a strange rash on the arms. I didn't think much of it at first, but it's getting worse. Oh, and another thing, I've been having these episodes of stomach pain and diarrhea. The diarrhea has been pretty severe over the last 2 days.
That's quite a range of symptoms. Let's go over your medical history next. Are you currently on any medications, or have you taken anything recently?
I've been taking ibuprofen to try and reduce the pain, but it doesn't seem to be helping much. I've also tried taking an over-the-counter flu remedy, but I can't remember the exact name. I've been drinking lots of fluids and tried herbal teas to help with my throat, but honestly, nothing has made much of a difference.
Thanks for that information. Now, this may be important. Have you traveled recently, especially to any countries outside of the region?
Yes, actually. I returned from West Africa about 2 weeks ago. I was there for a work trip for around 10 days. I didn't think anything of it, though, because I was mostly in the cities and didn't really venture out into rural areas.
That's useful to know. Mihira, based on the symptoms you've described, I'm concerned that this could be Ebola. It's a viral infection that can cause these kinds of symptoms, especially after exposure in regions where outbreaks occur.
Oh no. That sounds really serious.
I understand this is alarming. However, it's important that we don't jump to conclusions just yet. I'll order a polymerase chain reaction test, which is used to detect the virus. We'll also run a complete blood count to check your platelet and white blood cell levels, and liver function tests to monitor how your liver is handling the infection. We may also need to test for malaria, just to rule it out.
Okay, I understand. What happens if it is the former?
Then you'll need to be isolated to prevent the spreading of the virus. Treatment usually involves supportive care, such as intravenous fluids, electrolytes, and oxygen if needed. You might also receive antiviral medications like remdesivir, which has been shown to help in some cases.
I'm really worried, but I appreciate your help.
You're welcome, Mihira. I'll see you at the next appointment. Take care in the meantime.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. You'll have time to read each question before you listen. Now look at question 25. You hear a nurse called Mihira talking to a patient. Now read the question.
Hello, Mr. Hilton. Can you please describe your symptoms?
I've been experiencing chest pain and shortness of breath. It started a few hours ago.
Have you had any other symptoms, such as dizziness or nausea?
Yes, I've felt a little dizzy and lightheaded.
Can you rate the pain on a scale of 1 to 10, where 1 is the least painful and 10 is the worst?
It's about a 7.
We'll need to assess your vital signs and conduct some tests to determine the cause of your symptoms. Have you experienced any recent injuries or illnesses?
I had a recent cold, but I've recovered from that.
We'll need to rule out any underlying medical conditions. Have you had any recent chest pain or heart problems?
No, not that I can recall. Now look at question 26. You hear a physiotherapist called Mihira talking to a patient. Now read the question.
Mr. Hilton, it's important to lift heavy objects correctly to avoid injury. Can you demonstrate how you typically lift a box?
I usually bend down and lift with my back straight.
That's not the correct technique. Bending at the waist can strain your back. Instead, try squatting down and lifting with your legs. Keep your back straight and avoid twisting your body.
I'll try that. It feels a bit awkward.
It might take some practice, but lifting with your legs will reduce the strain on your back. Remember to keep the object close to your body and lift with your legs, not your back.
I'll be sure to use the proper technique. Is there anything else I should keep in mind?
It's also important to lift within your capabilities. Don't attempt to lift objects that are too heavy for you. If you're unsure, ask for help.
Now look at question 27. You hear a speech therapist called Mihira talking to a parent. Now read the question.
Mr. and Mrs. Lewis, I'm pleased to report that Ryan has made significant progress in his speech therapy sessions. His articulation has improved significantly, and he's communicating more effectively.
That's wonderful news, Mihira. We're so proud of his progress.
I'm impressed with Ryan's dedication and hard work. He's been practicing his speech exercises at home, and it's paying off.
We've been encouraging him to practice regularly. It's been challenging, but we've seen a positive impact.
It's important to continue with the speech therapy sessions and practice at home. The more he practices, the better his speech will become.
Are there any specific activities or strategies we can use to reinforce his speech skills at home?
We can incorporate speech exercises into everyday activities, such as reading books or singing songs together. Encouraging him to participate in social activities can also help him practice his communication skills.
Thank you for your guidance. We'll continue to support Ryan's progress and ensure he stays motivated. Now look at question 28. You hear a social worker called Mihira talking to a GP. Now read the question.
Dr. Lewis, I'm concerned about Mr. Hilton's social isolation. He lives alone and has limited social interactions.
That's a valid concern. Social isolation can have a significant impact on mental and physical health.
Mr. Hilton has expressed feelings of loneliness and depression. He's also struggling with daily activities due to limited mobility.
We should assess his functional status and identify any barriers to social participation. Perhaps a home health aide could provide assistance with daily tasks and help him connect with others.
That's a good idea. I'll explore the possibility of home health services. We should also consider connecting Mr. Hilton with social groups or community activities that align with his interests.
That's excellent. Social interaction can be beneficial for his mental and emotional well-being.
I'll reach out to local community organizations and see if there are any suitable programs for Mr. Hilton. Now look at question 29. You hear a surgeon called Mihira talking to a head nurse. Now read the question. Nurse Lewis, I'm concerned about Mr. Hilton's post-operative recovery. He's experiencing increased pain and swelling at the surgical site.
Yes, I've noticed those changes. His vital signs are stable, but he seems uncomfortable.
We should assess the wound and check for any signs of infection. Let's also review his pain management plan and ensure he's receiving adequate pain relief.
I'll prepare the necessary supplies and check his medication administration record.
We might need to adjust his pain medication or consider additional interventions if his pain persists. It's important to manage his pain effectively to promote healing and prevent complications.
Should we consult with a pain management specialist?
That's a good idea. A specialist can provide additional guidance on pain management strategies. We can also explore the possibility of nerve blocks or other interventional pain management techniques.
I'll coordinate with the pain management team and inform Mr. Hilton about the plan.
Now look at question 30. You hear a head nurse called Mihira talking to a nurses. Now read the question.
Team, I'm excited to announce that we'll be implementing new tablet devices for all nursing staff. These devices will revolutionize the way we access and manage patient information.
That sounds great. What kind of features will these tablets have?
The tablets will be equipped with advanced software that allows us to access patient charts, order medications, and document care. They'll also have secure connectivity to our hospital network.
Will this replace the traditional paper charts?
Yes, the tablets will serve as our primary source of patient information. We'll gradually phase out paper charts.
Will there be any training on how to use these tablets?
We'll provide comprehensive training sessions to ensure everyone is comfortable using the new technology. There will also be ongoing support available if you have any questions or encounter difficulties.
That is the end of Part B. Now look at Part C. Part C. Extract 1. Questions 31 to 36. You now have 90 seconds to read questions 31 to 36. You hear the conversation between a radiologist, Dr. Mihira, and an interviewer. Dr. Mihira, thank you for joining us today. Let's dive right in. Radiology has made significant strides in recent years, but what are some of the current limitations in the technology that still challenge your field?
Thank you for having me. Radiology has undoubtedly come a long way, but there are still several inherent limitations in the current technology that impede optimal performance. While our imaging modalities, like MRI and CT scans, are advanced, they sometimes fail to pick up early-stage lesions or abnormalities that are critical for early diagnosis. For instance, smaller tumors or subtle tissue damage often evade detection, either because of the limitations in resolution or because of overlapping structures in the body that distort the image. So, one of the primary concerns is the accuracy of imaging in detecting minute abnormalities, particularly in the early stages of diseases. Additionally, another issue is related to radiation exposure. Although advancements have made diagnostic imaging safer, we're still working with the challenge of minimizing radiation without compromising image quality. The more scans a patient undergoes, the higher their exposure, and in long-term cases, this can become a significant health concern. So, while we have improved a lot, these aspects still create gaps in truly achieving what I would call comprehensive diagnostic accuracy.
Interesting. Given those challenges, how do you believe we can overcome these limitations? What steps are being taken, both in research and in practice, to address these Mihira?
It's a multifaceted problem that requires a blend of innovation, collaboration, and meticulous execution to overcome. First, I think the development of artificial intelligence, AI, and machine learning, ML, will play a pivotal role in augmenting radiologists' interpretations. By training algorithms on vast datasets, AI could help detect patterns and subtle anomalies that are otherwise missed by the human eye or current software. But it's not just about AI alone. Another way to overcome these limitations is by advancing hybrid imaging technologies. A combination of PET scans with MRIs, for instance, is something we are exploring. These multimodal approaches could enhance both anatomical and molecular imaging, providing a clearer picture of what's happening in the body. Moreover, improvements in image-guided interventions are another avenue. For example, real-time navigation systems are being developed to guide biopsies or surgeries with unprecedented precision, thereby reducing the margin of error. That said, it's crucial to note that these solutions are still in their infancy in many cases. Overcoming the limitations is less about a singular breakthrough and more about a confluence of innovations coming together cohesively.
That sounds like a long-term endeavor. Mihira, what are some specific advancements in the field that you and your team are aiming for in the next few years?
Yes, it is long-term, but also exciting. The advancements we're aiming for involve refining the technologies we've just talked about. One major area is the development of what we call functional imaging, essentially, being able to visualize not just the structure of tissues, but how they function at a cellular or even molecular level. This could allow us to identify diseases before any structural changes occur, which would be a game changer for early diagnosis, especially in oncology. Another advancement we're working towards is improving 3D and 4D imaging. These would provide real-time dynamic images that offer an even more accurate depiction of how the body is functioning over time. Furthermore, we're actively looking at how to reduce the dose of radiation further without compromising image clarity. This is particularly important for pediatric patients or those who require repeated scans. Our aim is to reach a point where imaging is not only diagnostically flawless but also extremely safe.
Those advancements sound transformative, Mihira. Could you tell us more about the specific plans your team has in place to reach these goals?
Absolutely. Our team has adopted a phased approach. The major aspect of our plan is to engage in large-scale clinical trials. We're currently seeking approval to initiate a trial focused on low-dose, high-resolution imaging techniques. These trials will not only help validate the technology but also provide crucial data for regulatory bodies, which is a big step toward commercial adoption. We are in the midst of implementing machine learning algorithms for clinical testing, which will allow us to evaluate how these systems work in real-world settings. This involves integrating AI into routine radiological assessments to assist radiologists in flagging potential issues. The idea is not to replace the human element but to enhance it. For functional imaging, we are collaborating with molecular biologists and technologists to improve tracer technologies that will help us visualize cellular activity. The key here is cross-disciplinary research. Radiology can't advance in isolation. In parallel, we're establishing partnerships with tech companies to further develop 3D and 4D imaging protocols.
That's a very structured plan. How do you measure the progress of such an expansive research initiative, Mihira?
Measuring progress in such a dynamic and multi-layered field is complex. First and foremost, we rely on clinical validation. Every new tool or technology undergoes rigorous testing in a clinical environment to assess its effectiveness. We also measure progress by patient outcomes, whether early diagnosis rates are improving or if interventions are becoming less invasive and more successful. Additionally, we assess how well these technologies integrate into existing workflows. It's one thing to develop a groundbreaking tool, but if it doesn't fit seamlessly into a clinical setting, it won't have the desired impact. Regulatory milestones are another key metric. For instance, receiving approval from health authorities for a new imaging technique marks significant progress. Lastly, we track academic metrics, publications in peer-reviewed journals, conference presentations, and citations, as these reflect the scientific community's reception of our work.
It sounds like your team has a clear roadmap. With all these plans in place, Mihira, when do you expect to accomplish the current phase of your work?
Timelines in research are always fluid, but we're aiming to have significant breakthroughs within the next 3 to 5 years. That's for the core areas we're focusing on, like integrating AI into clinical practice and refining functional imaging. However, when you factor in clinical trials, regulatory approvals, and real-world integration, the complete rollout of some of these technologies could take a decade or more. It's important to strike a balance between optimism and realism in research. While we're pushing forward aggressively, medical advancements require thorough testing to ensure both efficacy and safety. We do, however, anticipate seeing early results, especially in AI-driven diagnostic tools, as soon as the next couple of years.
Now look at Extract 2. Questions 37 to 42. You hear a GP, Jordan Wilson, talking about the workplace. You now have 90 seconds to read questions 37 to 42.
Good morning, everyone. Today, I'd like to share a patient experience that has profoundly impacted me. As healthcare providers, we all encounter cases that shape our careers in unique ways. For me, it's Mihira, a patient whose resilience and journey continue to resonate with me, pushing me to reflect on the depth of care and decision-making that defines our practice. Mihira came to me with multiple chronic conditions, including type 1 diabetes and advanced rheumatoid arthritis, but what truly struck me was the impact her illness had on her psychological well-being. I recall vividly how Mihira broke down during one consultation, revealing that she felt like a burden to her family, constantly questioning the value of the treatments and the impact they would have on her quality of life. Her case stands out not only due to the complexity of her medical needs but also the emotional and psychological dimensions of her care. She was a young woman, struggling not just with the physical toll of her conditions, but with the isolation and helplessness that often accompany long-term illness. Her emotional distress was manifesting in ways that I hadn't initially recognized: frequent non-compliance with treatment, unexplained pain exacerbations, and missed appointments. This holistic complexity, the intertwining of physical and mental health, and the ripple effects on her family, demanded a deeper level of engagement from me as her GP. The most challenging situation arose during a particularly acute phase of her condition, where her blood sugar levels were dangerously erratic despite our best efforts to stabilize her with insulin adjustments. At the same time, her rheumatoid arthritis had flared up, causing severe joint inflammation that severely limited her mobility. Mihira had stopped engaging in her physiotherapy exercises because the pain was unbearable. The decision I faced was multifaceted. Should I escalate her diabetes management by referring her to a specialist endocrinologist, knowing it would likely add another layer of stress for Mihira? Should I focus on aggressive pain management for her arthritis, risking opioid dependence, or explore more experimental treatments? And then there was the mental health aspect. Her withdrawal from social support systems, and clear signs of depression, needed urgent attention. After much deliberation and consultation with my colleagues, I chose a holistic approach. Instead of isolating one aspect of her care, I decided to integrate her physical and mental health management. I referred her to a pain specialist but avoided a heavy reliance on opioids. Simultaneously, I arranged for psychological support, emphasizing cognitive behavioral therapy to help her cope with the emotional toll of chronic illness. It wasn't an easy decision, as it involved balancing many moving parts, but it felt necessary to tackle the interconnectedness of her conditions. Supporting Mihira moving forward required both structured medical interventions and a deeply personalized care plan. I worked to establish a clear treatment regime that respected her autonomy, ensuring she felt in control of her care. This included simplifying her medication regimen and allowing for flexible adjustments based on her daily pain and energy levels. I also collaborated with a dietitian to fine-tune her nutritional plan, which would help stabilize her diabetes without making her feel restricted. Additionally, we created a pain management plan that incorporated not only medication but alternative therapies like acupuncture and hydrotherapy, which Mihira showed interest in. Beyond that, I encouraged her to explore mindfulness and meditation techniques as a complementary strategy to help manage her emotional distress. Above all, I committed to regular follow-ups, checking in on her not only as a patient but as a person. I wanted to create a safe space where Mihira felt supported, not just medically managed. From the outset, this case required seamless coordination across multiple specialties. I worked closely with the endocrinologist managing her diabetes, ensuring that any adjustments to her medication were aligned with her pain management plan. The pain specialist played a crucial role in fine-tuning her treatment to avoid long-term dependence on painkillers. Equally important was the collaboration with her physiotherapist, who needed to adapt exercises to suit her fluctuating pain levels while maintaining her mobility. The input of a psychologist was invaluable, helping me understand how Mihira's mental health was impacting her physical symptoms. We met regularly to discuss her progress and make adjustments to her treatment plan based on how she responded to different therapies. Communication between team members was critical, each specialist had to be in sync, ensuring that changes in one area did not negatively impact another. Through shared records, joint consultations, and a patient-centered focus, we created a cohesive care plan for Mihira. The result of this integrated approach was profound, albeit gradual. After several months, Mihira's blood sugar levels stabilized significantly, and her episodes of extreme pain became less frequent. More importantly, she began engaging with her physiotherapy again, and her mental health improved. She reported feeling more in control of her life and more hopeful about the future. While her conditions remain chronic, we've managed to establish a routine that gives her the quality of life she yearned for. Our regular check-ins continue, and though there are occasional setbacks, Mihira has regained a sense of agency over her health. The multidisciplinary approach allowed us to address not just her symptoms but the underlying mental and emotional struggles that exacerbated her conditions. This case has left a lasting mark on my career. It reinforced for me the importance of seeing beyond the immediate medical issues and considering the patient's full experience. I learned that sometimes, the most effective interventions are not the ones found in textbooks but those that address the intersection of the physical and psychological. This experience has sharpened my ability to think laterally about patient care. It also deepened my appreciation for multidisciplinary teamwork, where the shared expertise of various professionals can yield solutions that no single practitioner could arrive at alone. In Mihira's case, I was reminded that the most challenging situations often offer the greatest opportunities for growth, not only for the patient but for the clinician as well.
That is the end of your OET listening test. Now check the answers.